Good afternoon, everybody. My name is Cristobal Jr., student physical therapy assistant. Today, I'm going to be discussing neuromuscular electrical stimulation, NMES, and specifically what it is used for in the clinical setting, when we might and might not use it, when we will specifically not use it, settings specifically with this device, the Intellect NMES device, along with a brief demonstration as to utilizing it on a patient. And today the patient will be myself. It's going to be a brief demonstration. So let's go ahead and get started with talking about the device. In the clinical setting, we would use the NMES systems when it comes to muscular strengthening, muscular re-education, muscular spasms or guarding reduction, and edema reduction, while also utilizing muscle pumps. So muscle contractions is the main goal with NMES, along with muscle relaxation. So when we may or may not use it is going to be our precautions. Certain precautions that we're not going to use this is with patients with cancer, patients with cardiac conditions, if they have any cuts or wounds in local areas that we're treating, and if they have any impaired cognition and impaired sensations. With those mentioned precautions, that's going to need the clearance of a physician or our physical therapist to say if we can or cannot use an NMES device. However, there are contraindications where we're not going to be using NMES at all, such as if a patient has a pacemaker for their heart, if we're not going to place it over the carotid artery, we're not placing it on their eyes, we're not placing it on their gonads, and we are not going to be treating female patients that are pregnant, especially if we're going to be treating the lower abdomen area. We're not going to be using NMES at all for patients with those said conditions. Now, the NMES device is a functional device. This means that while it's also sending electrical stimulations, we're utilizing our mind and muscle connection that we have naturally as humans to go ahead and engage those muscles as much as we can. In my example of quadriceps, I'd use it when it's sending electrical signals. I'd utilize my mind muscle connection to go ahead and engage my quadricep muscles for knee extension. Or for another example, if it's sending into my biceps brachii, I'd use my mind muscle connection to go ahead and do some elbow flexion. Now, treatment time is going to be varying based on the functional goals that we're aiming for muscular strengthening, muscular spasms, muscular guarding reduction. We're going to go ahead and treat it for 10 to 20 minutes. When it comes to muscular re-education, it's based on the functional task that is set by the physical therapist or the patient. What their goal is and how long that treatment will be will vary based on that activity. When it comes to edema reduction with utilizing natural muscle pumping skills, it's going to be 20 to 30 minutes. So here's a close-up device that we're going to be utilizing today and in our clinics. From top to bottom, we have two channel outlets right here where we would plug electrode wires that I will show you during the demonstration. We plug those in here for channel 1. Channel 2, right below it, we have lights that will show us if they are activated or not activated. Right here, when we lift this little lever, we have our intensity dial. If a battery was plugged in, like right now, there's no battery. When we turn this, here's an audible click. Once we hear the click, and if a battery was inside, we'd see that this green light appears to show that the device is on. However, no battery just yet. When it comes to intensity, this is something we want to educate the patient about on how to utilize the dial. So when they turn it on and a light would come on, this is where they would adjust the intensity themselves so they can reach a muscular contraction feeling. Once we open up the device, by just pulling on this and we see the lid, we get a bunch of different settings. So from left to right, this is our contraction on time. So this is going to be when the device is sending electrical signals to the muscle. Right now there is a dial based on seconds. Right now I just turned it to 1, or we can have the contraction going all the way and sending signals for up to a duration of 30 seconds. Typically, we would have this on a 1-to-3 ratio. For other patients, we might have it on a 1-to-5 ratio, 1-to-1. I'll explain those details in a little bit for parameters. Anyways, moving on, we have our frequency in hertz. So frequency is really dependent on the muscle belly size. So let's say we're treating the quadricep muscles. We're going to go ahead and be amped up all the way to 100 hertz because 100 is to address larger muscle groups like the quadriceps. Maybe our patient is having issues with wrist flexion going on like that. So we're going to be attacking the muscle groups of the flexor carpus like the radialis or the ulnaris. We'll go ahead and turn that frequency down to 30 because it is a smaller muscle group than the quadricep muscles. And possibly if we're having patients with issues with maybe their pinky muscles for their fifth digit, like the opponent's digiti minimi, or even their thumb muscles, like the opponent's, then we're going to go ahead and turn that down to 5 because it's a very small muscle group. For my example today, I'm going to show you guys at 100 frequency because once again, it's a large muscle group that I'm treating, like the quadriceps. So here's the ramp setting. The best way to describe ramp is a gradual buildup of electrical stimulation being sent. So rather than it going all at once into the selected muscle group, it's a gradual buildup of slow distributions of electrical stimulations until it reaches its peak stimulation point. So we have ramp setting 1, 3, and 5, meaning it's currently at 3. It would take 3 seconds until it reaches max stimulation of this device. If a patient can't tolerate quick stimulations like 3 seconds, we can still turn that up to 5. So it will take 5 seconds for it to reach peak stimulation at the selected muscle groups. Now here is the off time under the tab relaxation. So once again, it is set to 1 for its dial. This is measured in seconds. So once we keep turning it up, there's more off time, meaning this device isn't sending out electrical signals to the targeted muscle group. This is going to give the patient time to rest, relax, and recuperate. This can vary, and like I've said about the 1-to-5 ratio, 1-to-3 ratio is 1-to-1. This is dependent on both these dials. So more information about that. So really dive in about the on and off time of contraction and relaxation. Pretty much what it is how much time will a patient be receiving electrical stimulation to promote contractions for the on time, and how much off time where a patient will not be receiving electrical stimulations so they can go ahead and rest and relax that muscle that is being targeted for recuperation of any neurotransmitters, ions, whatever is going on physiologically to allow them to be able to do their next contraction. So typically on and off time is based on both treatment goals along with patient ability to rest, relax, and recuperate depending on how quickly they might fatigue. So in this, we don't have a specific dial for 10, so I would put it right above 7 to be an estimate of 10, and then right above 27 to be an estimate of 30 seconds. So 10 seconds, 30 seconds. That would mean 10 seconds on for contractions, 30 seconds off for relaxations. That's a 1-to-3 ratio. If this dial had 50, which it doesn't, it would be a 10-to-50, meaning it would be a 1-to-5 ratio for contractions and relaxations. This device, however, doesn't have that 50 seconds for relaxation because the dial stops at 45. So we would turn this down to be 7-to-35 to meet that 1-to-5 ratio. So it will be 7 seconds on for contraction time, 35 seconds off on relaxation time. Our guide says that muscular strengthening is going to be a 1-to-3 ratio where it's 10 seconds on, 30 seconds off. Muscular re-education is going to be 1-to-1, 1-to-5, and muscle guarding, muscle spasms, and edema reduction would be 1-to-1. However, this is also patient dependent on how fast they may fatigue. For example, if we have a patient who is very easily fatigued, maybe we want to give them an increased amount of time of relaxation after their first contraction so they can go ahead and rest, relax, and recuperate for the next contraction because we want them to be lasting the whole duration of treatment. On the other hand, if we have a sports athlete who has very high endurance and doesn't fatigue as easily, maybe we want to have a 1-to-1 ratio where it's 10 seconds on, 10 seconds off, so we can go ahead and work their endurance. Because if we have too much off time, they're not really receiving too much benefit, or they're receiving no benefit for endurance training for their muscles. Unlike the IFC device, we don't have anything about sweep. We don't have anything about vector scans to adjust the treatment areas. It's really dependent on wherever we're going to place those electropads on the muscle bellies of what we are treating. So I'm going to go ahead and set this up real quickly on myself and just give a brief demonstration and explanation as to what's going on while utilizing this device to see it in action. So I'm going to go ahead and prepare the area that I'm treating, my quadriceps, by using an alcohol wipe, so I can go at any lotion, sweat, dirt, debris, anything that might affect the electrode placement for it to stick on, along with the electrical stimulations being sent to the skin. So let's go ahead and just clean that up with a alcohol wipe. Electrode placement is important here. I'm very lean, where we can see the muscle bellies of the vastus medius, rectus femoris, vastus lateralis. However, with other patients, it might not be as easy as finding it on myself. We're going to go ahead and palpate around the treatment area so we can go ahead and find those muscle bellies, because that's where we're going to be placing these electropads. So I'm going to put those on. So there we go. I've gone ahead and placed the electropads on my quads. So I have one placed on the muscle belly of the vastus lateralis. I have one placed on the muscle belly of the rectus femoris. I have two set on the vastus lateralis, just divided by the iliotibial tract. So it's right on the vastus lateralis here and here on those muscle bellies. It's important we place it on the muscle bellies, on the muscles that we're trying to engage. In this sense, I'm trying to go for knee extensions. So obviously I want to go with the quadricep muscle group. If I'm working something like elbow flexion, I'll go ahead and place electropads on the muscle bellies of the biceps brachii over here. Maybe wrist flexion, like that. I'm going to place it on the flexor carpi groups like the radialis and the ulnaris. But for today's example, to make it nice and easy, on the quadriceps for knee extension. I'm going to plug into channel 1 and I'm plugged in for channel 2. I'm going to put my battery in here. Let me go ahead and plug in channel 1 into these muscles over here for the vastus medius and rectus femoris. And then channel 2 will be on the vastus lateralis. Now, we could treat two different muscle groups here if we really wanted to. Let's say I'm just treating a few of my quadricep muscle groups and I'm training my biceps brachii muscle. I would move any of the two into my biceps brachii, and the important emphasis over there is with those electric pads, I'll go ahead and use one specific wire leading to the biceps and then use another wire to lead to the muscle groups for the quadriceps. So that way I can have different intensities for both muscle groups. However, because I only have one frequency, I wouldn't do that, because I would set this at 100 to go ahead and address the quadriceps, and 100 is a little too much for the biceps brachii group. We're going to go ahead and show a brief example of muscle strengthening going on. So I'll go ahead and have my off time will be at 10 seconds as well. So it's going to be a 1-to-1 ratio, because I feel as if I am athletic, I can go ahead and have that muscular contraction and relaxation go nice and quick, because I have the endurance, and also for video purpose to get this sped up. Frequency is at 100. My ramps is going to be set at 3. So it's a gradual buildup of 3 seconds to disperse all that stimulation. And now I'll go ahead and turn it on. Hear that audible click in both. There is an orange light to indicate currents are being sent in both channels. However, intensity is too low that I do not feel anything. So this is where I'm gonna go ahead and adjust that intensity through these dials until I can feel a muscular contraction. Now I'm feeling a tingling sensation, but I want the strong muscular contraction. Right at the end over there, I started feeling the muscle twitches. Lights are on again. Ooh, there we go. Okay. There we go. So now it is engaging my muscles. I'm feeling a strong enough contraction, but it's also the patient's ability to go ahead and do the motion as well while the lights are on and while the electrical stimulants are being sent to the muscle group we're training. So boom, I'm seeing this light and I'm feeling my muscles engage when it comes to feeling the electric stimulants. So I'm also using my mind to muscle connection to go ahead and activate my own muscles. Muscle twitching going on right now, but it's not strong enough to be sending me into muscular contractions. So I'm going to go ahead and turn up that dial even more. And once again, intensity is based on the patient preference. Right there is a lot. I'm feeling almost like a cramping sensation, so I'm going to turn that down. Pretty much what we're trying to aim for with intensity is almost contraction. The easiest way to think of contraction is curling your biceps. We have this firm belly going on with muscle shortening. We're trying to feel that in the muscle group we're targeting today, the quadriceps in my example. So I'm doing this in the purpose of muscle strengthening. So I would typically go for 10 to 20 minutes for treatment time. However, I'm just cutting it short today just to provide an example how we would utilize the Intellect NMES device in a clinical setting and also teaching a patient how to use it. So I'll go ahead and turn it off by just turning the dials down. Audible click, audible click. Device is off. Now it's safe to go ahead and remove my wires that are connected. Wrap the wires up, go ahead and take the battery out. It's in the box. Close it up. We can reuse my own personal electropads. So that's the Intellect NMES device in a nutshell. If there's any questions, any clarification necessary, go ahead, feel free to leave a comment, ask some questions. I'll get back to y'all as soon as possible. Thank you.